I'm going to kick us off today with our first presentation. Okay, so as Elisa said in her introduction, we now are up to 25 states that are testing their newborns for adrenal leukodystrophy, which is amazing. In the past year, we've had 5 states come on board. So Oklahoma started in March, in Maine, and in April, we had Maine and West Virginia begin testing. In July, Indiana, and then in December, Missouri. And then for those of you following us on social media, I'm sure you saw last week we posted that Arizona was the first state to begin screening in 2022, which brought us to that halfway mark of 25. For those of you that aren't familiar with the history, this is just a very brief synopsis. Again, thanks to Elisa's efforts, Aiden's Law was signed on March 29th, 2013, and testing began here in New York on December 30th of that year. With regards to national testing, in addition to the state-by-state advocacy, ALD was added to the Federal Recommended Uniform Screening Panel, or what we call the RUSP for short, in February of 2016. So what the RUSP means is there's a whole lengthy nomination process, and in order for a disease to make its way on the RUSP, that basically means 2 important things. That number one, there is a valid test that can be used at the newborn screen level, and there's also a valid treatment that, if implemented enough, will make a difference in the life of a child. So the RUSP is a great tool. The issue is there is approximately a 10, sometimes more than 10-year delay for a disease on the RUSP to be implemented in all 50 states. And as we know, what this results in is inequity, healthcare disparity, and what we dub in our legislative efforts as death by zip code. So in addition to ALD, there are 3 other conditions that are currently placed on the RUSP that are not being implemented in all 50 states. The other 3 conditions are MPS 1, Pompe, and SMA. And this map we put together shows which states are RUSP compliant. So in other words, they are testing for all of these conditions that are recommended at the federal level. And as you can see, there are not that many. I believe with the addition of Missouri in December, it's only 18 states that are RUSP compliant. So what are we doing at the ALD Alliance to take action? What we're doing is educating people about the importance of dried blood spots in newborn screening research, number one. So the dried blood spot cards are the card that during the newborn screening process, when the baby's heel is pricked and the blood falls onto the card, that not only benefits the baby and the family so that that baby can be screened, but those cards are de-identified and they're used for research so that more tests can be discovered. It's a really important process, and it's something that even as a newborn screen mom, initially I didn't really understand. So we do like to educate people about that. If we have time at some point during the conference today, I'll play a video that we created with the help of Global Genes this year, just to educate families and the general public about the importance of this research. We've also been fighting very hard the last several years to include appropriations language in the federal budget that would direct the CDC to fund testing for all RUSP conditions. And you can take a look at the map. This is directly from the CDC website. If you type in their search engine, improving disease detection in newborns, this will come up, and you can see the states that have benefited already from these grants from the CDC. And much of this funding is to help the state labs get testing on these RUSP conditions. And we can just tell you personally, I don't know if they're on yet today, but we were helping just before the Christmas holiday, North Carolina, with their materials to give to parents and the families that are identified. And they did mention, you know, we were able to get this going because of a grant from the CDC. So it's a very important project, like I said, that we've been working on for the last several years. And the goal, of course, is to be RUSP compliant by 2025. And our efforts will continue going state by state. So here is the language that is in the appropriations request for those who would like to see it. But the gist of it is asking the CDC to provide $15 million for timely implementation of newborn screening conditions, again, with the goal to be compliant by 2025. We've been very fortunate to benefit from some great relationships with our local legislators here in New York. So these two right here, this is Yvette Clark here in Brooklyn, and Lee Zeldin, who's out in Long Island. One is a Democrat, one is a Republican, so it's nice to have that bipartisan support. They've been kind enough the last few years to put out a Dear Colleague letter. So what that means, it's a letter that goes out to their fellow congressional representatives, asking them to support this initiative and to sign on to support it. We had the most support we ever did last year. So these were the representatives that signed on in 2021. Right now, what I really want to do is say thank you to everyone, the families, the advocates, the doctors, the clinicians, the people in the labs who have supported us throughout this initiative. I believe in addition to the sign-ons that you just saw, I think we had 8 meetings with senators and their staff last year, which was great. We had some really good conversations. Many of our families we reached out to just because this is the way their staff offices run. They're very busy. Sometimes we only get 1 or 2 days notice when we can wiggle onto their calendar. And there really are just too many of you to thank, but just off the top of my head, because it's the last meeting we had, Julie Pershke, who is in Missouri, runs her own nonprofit. Actually, her run was happening, I think, around the time that we reached out to her. 2 days notice, we said, hey, we have this meeting with the senator in your state. And of course it was during school pickup time, I think, and she dropped everything she was doing, which also included getting Missouri ready for screening because they began in December. And she came on, and I can just tell you from personal experience, these meetings are so much more meaningful when these legislators can hear from their own constituents. It's what really motivates them. So I want to say thank you for all of you who have made time to help with this. And we're pushing forward in 2022. So if we reach out to you again, I apologize if it's short notice, but we really hope that you will help us with this. Even if you live in a state that is already screening, you can still help with this federal initiative. So please feel free to reach out to me. My email address is there. We did also have some meetings last year just to kind of keep everyone on track on the progress we've made. So we are looking forward to having those legislative action meetings again. We'll probably have the next one in February. So again, if you'd like to be included in that, please email me. And in the meantime, you can go to our website, www.aldalliance.org. And if you click on legislative action, you'll see some information on what we've done so far. And we also have these one-pagers, which are really great for you in your advocacy, but they're also really good for the politicians. They like these one-pagers because it just kind of summarizes everything, gets to the point. And we have them for all 4 conditions that we're advocating for. So not just ALD, but also MPS 1, SMA, and Pompe. We've had families that were kind enough to let us profile their children. So I think with that, I do have a little time. Okay, so I'd like to briefly just touch upon some of the resources that exist. Some we've announced at other meetings, but I know we have a lot of new families joining this year. So this is our Parents Guide to ALD, which was just some great synergy of, clinicians, ALD experts, again, the labs and parents helped put this together. And it really was 6 years in the making. So you can go to the web version if you'd like to see it. It's www.aldnewbornscreening.org. It does exist as a web page that you can scroll through, or if you prefer to download a PDF, you can do that as well. And we also have it available in Spanish. Okay, so this is another program that we're so excited to kick off in 2022. We want to say thank you to Trevere for making this dream possible. We are going to be able to send out care packages to families that are diagnosed via newborn screening. So we got this idea last year. After our last virtual conference last year, we did an ALD family day, and we were able to send out a few items to the families to help the boys navigate the monitoring process. And we got such tremendous feedback on that. And Elisa and I said, wouldn't it be great if we could send this to every family receiving this diagnosis? So unfortunately, it's not an automatic thing because of the privacy rules around that. But please spread the word. And if you are a family that has been diagnosed, I would say within the past year, this will probably be most helpful to you. Thank you to the families last year that got the packages, that gave us the feedback, because it helped us kind of tailor these packages the way we wanted to. And I can tell you from experience, that's my son Jack in the picture, really, really helpful tools. So for example, there's this book that we always talk about called The Donut That Roared. And it was written by a teen author. His name is Jackson Grant, who has to go undergo frequent MRIs, not for ALD, but for another condition. So it's kind of his tips and tricks in his mind on how to walk these kids through it. We read it regularly, not just before MRIs, and it's been so helpful for him. And that's just one of the items that are included in that. So if you're a clinician, if you run a clinic, and please tell your families about this. And like I said, if you're an eligible family member, please, by all means, register for one. You can go to our website to find out more information on that. And then I mentioned earlier, we were fortunate to receive a Rare Equity grant from Global Genes this year to work on this important project, and it's a newborn screening education video. Like I said, if we have time later today, maybe I'll be able to play the video for you, but we created one in English and one in Spanish. We were able to interview Dr. Melissa Wasserstein, who is the principal investigator of Screen Plus. So she's running the largest multi-disorder pilot program here in New York City, where an additional 14 conditions can be screened for, but it's something that parents have to opt into. So our goal, not just with this pilot in mind, but all the pilots that are running around the country, is just to explain to parents as to why this is so important, not just for their baby and their family, but for the research overall.